I'd like to welcome everyone, and I don't know how many people we have online because I can't really see that.
It might just be those
I
three.
think it's
Just
that.
Auditor Dunkel.
Okay, so do you want to go around and introduce yourselves?
Kathy McDowell, City Council.
Carrie Davidson, Shelton School Board.
Kevin Chudy, Mason County Commission.
Sharon Trust, Mason County Commission.
Ian Tracy, Mason County Environmental Health Manager.
Melissa Casey, Community Health Manager.
Dave Wyndham, Director of Public Health.
And Peggy Van Busker, Hospital District 2, and we have quite an audience.
Ben Johnson, Mason County Public Health Substance Abuse Prevention Coalition Coordinator.
Emily Lehman, Mason County Public Health, Health Educator.
And are these your...
We're from Choice School.
Nevis Villa, I am Choice Alternative Schools student representative.
I am just part of leadership. I am also from Choice School.
I am Scott Bowen, and I am Activities Chair.
And what's your name?
I am Lucille.
Okay. And Constance?
Oh, Constance Gibson, I live in Union.
And who else do you have with you, Constance?
Oh, Louis.
And?
Good job.
Dave and Jesse Linnell, we're here to watch our daughter Lucille.
Okay.
Give her speak.
And
You did go down this year.
he's recording. And we have Steve on. Okay.
And Dr. Gardner is trying to find signal.
Okay.
Good afternoon, everybody. Thank you for letting me join your meeting.
Okay. Can I get a motion for the agenda?
So moved.
I'll second.
Any discussion? Hearing none. All those in favor?
Hi.
Okay. So there is a resolution for the dates because we didn't have a quorum last time. And we meet every other month, so January 24th, March 28th, May 23rd, July 25th, September 26th, and November 28th. It won't follow Thanksgiving this year.
Right.
So do I hear a motion to approve that?
So moved.
Second.
Any discussion on that? Hearing none. All those in favor?
Aye.
Any opposed? Okay. So, election of, or I guess, yeah. Next one is election of officers. Do we have any nominations?
Is this something you would like to continue doing?
Well, I don't mind, but would you like to do it?
Yeah, I'm already doing that for the school board, so.
How about you?
Yeah, I can.
Oh, I'm chair this year.
Oh,
I
Kevin?
like how this is going. See where this is headed.
Would you be willing?
Sure.
Okay. Any other nominations?
I'll second that nomination.
Hurry up.
Okay, all those in favor? Aye. So you want to take over, Kevin?
Sure. I'm gonna need to
Yay.
take back this agenda that we're sharing. We're woefully unprepared with materials.
Oh, well.
Are there any other officer positions, or is that it, Dave?
That's it.
Okay, okay. Did Dr. Gardner get reception, or?
I don't
do we
see her
wanna-
on there.
Oh, we gotta approve the minutes, so.
Yeah, we do. Sorry. While we're waiting on that, we have minutes from September and November of last year, 2022. If you've all had a chance to review it, entertain a motion on the minutes.
I
There
so
she is.
move.
I'll second.
It's been moved and seconded to approve the minutes as presented. Any discussion? Hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed? And the motion carries. Now our health officer report. Dr. Gardner?
Oh, yes.
Hi, I'm going to get off video because I'm in a place with poor reception, so you can hear me better.
Great.
All right, can everybody hear me okay?
Yes.
Okay, great. Thank you. Well, good afternoon. I wanted to start off my health officer's report talking about infectious diseases. I think that Dave Wyndham will be covering the COVID, influenza, and RSV season, but my health officer summary about those diseases is that it's been a rough season. I'm sure you've heard it called the triple-demic. This year's version of influenza was mostly influenza A, and it is another H1N1 virus like we saw the year of the swine flu. I believe this is why people were sicker with influenza this year than usual. Fortunately, the flu vaccine that we have this year does cover H1N1. So I am still recommending that people receive the vaccine because while we are seeing some tapering of the numbers of cases, there are still many months before flu season is over. Regarding tuberculosis, we have had several serious cases of tuberculosis in the county over the last few months. We've even seen 2 deaths from TB. Our team...
Yeah, it's just starting to ramp up.
Yeah.
And I guess we can come back to that. When she gets back in.
Okay. Well,
Oh, there she is.
Okay.
So if this continues, does she want to just call in on your phone and you put it on speaker?
Yeah, we can do that too. Hey, Dr. Gardner?
Yes.
Okay. If we lose you again, just call me on my phone.
Okay, can you text me that number to Dave?
Yeah.
Okay, great. I'll continue until I lose you again. I would like to thank the partners that have been helping us perform contact tracing around our positive cases. That includes the Department of Health and Mason Health as well. So our gratitude to both of those entities. This brings up a question that I wanted to present to the Board of Health about resource allocation. Our communicable diseases team is quite small. Essentially, it's 1 person. My question to the Board of Health is, do you think that we should start doing more screening to identify TB cases in our community before they become very ill and to avoid positive cases from potentially spreading? And since the connection poor, I'm going to keep on and take answer to the questions at the end. Regarding hepatitis C, we still have money from the state to hire an individual to do case management of hepatitis C cases and help bring them to treatment. Presentation was made at the Mason Matters meeting of November 4th, and interest.
And there she goes. I texted her about this number, so. There we go. Okay, Dr. Gardner, you are on speaker.
Okay, great, thank you. So interestingly, 50% of our hepatitis C cases in Mason County are in people who are 55 years or older. And the reason why this is interesting is that one of the barriers to treatment is not the cost of treatment, because this is a population that is largely insured one way or the other. The folks that came and did the presentation told us that the rate of treatment in Mason County of people with hepatitis C is less than 10%. And there are many barriers to getting treated, but the cost of the treatment is surprisingly not one of them. And so we, the Public Health Department, come to the Board of Health to seek your assistance in helping us get patients to treatment. Hepatitis C can be treated in most patients with simply a pill that is taken for 8 weeks. And then when we treat hepatitis C, we avoid liver damage, liver cancer, and then death from liver disease. And then my last infectious disease update is that the HPV, the human papilloma virus. There is a vaccine for that, as you all know, and it was recommended for people who are 12 years or older. This Washington State has just lowered that recommended age to age 9. I want to move on to substance abuse. There is a new drug on the streets that you may or may not have heard of. It's xylazine, which is a veterinary sedative and a muscle relaxant. It is called Tranq by people who use it, TRANQ. It's used in all the usual ways, IV, sub-Q, swallowing, and smoking. It is used both intentionally and unintentionally when it's cut with other drugs. What's unusual about this drug is 2 main points. One is that it causes severe wounds, in some cases leading to amputation. And the other thing that it does is because it's a veterinary sedative, it leads to prolonged sedation. It is also addictive like other drugs in its class, and it is being seen as a more common cause of death in the places where this drug is being used. It does not respond to Narcan. This is simply an informational message that I wanted to get out to the Board of Health and the community in general. This is also time for strategic planning in the Department of Public Health. We create a 3-year work plan to be developed, and Dave will talk to you about his. And I wanted to talk to you about the state of the health in Mason County in the terms of a few broad themes. And my question again to the Board of Health is, do you see these as the broad themes also? And I would look forward to your input as to the best way to prioritize my time serving the people of Mason County in my work plan. So first on the list is homelessness. Public health cannot provide housing, but we can help with the coordination of services and to respond and assist with sanitation assessments when homeless camps and situations are in place. The city has taken the lead with a task force. We were grateful to be asked to join the task force, and we would like to continue working with our city and county on this problem. It's something that we do have a lot of experience with. I'm also interested in the Board of Health's opinion on fresh water. Currently, we don't do much assessment of water quality in the freshwater lakes that are so prevalent in Mason County. Would this be a priority to the board? We also do some work in the substance use and treatment arena, but we have such limited services in the county to address this problem. How do we work with the Board of Health to address this? Smoking rates in Mason County are still high. We are in the top 30% of Washington counties by last available data. We also have work to do in TB and hepatitis screening, our vaccination uptake, and in particular, vaccination uptake against childhood diseases, which has been declining nationwide. This is causing the emergence of infectious diseases that would have been unheard of 20 years ago. Diseases like polio, measles, mumps, and rubella. The second broad stroke that I would see in the work plan is tackling unity. I see that there is room for improvement in the coordination of care services, both in direct healthcare as well as social services across the county. Everyone is very busy, and COVID has caused strain to our healthcare system with both resources and staffing. And I understand that everybody has less time to coordinate healthcare and services. I also see a lack of unity within our community on the value of public health. The COVID pandemic focused people on one aspect of public health, and in many ways, I feel that public sentiment is in danger of throwing out the baby with the bathwater. Public health grew out of the days when cholera was being spread in drinking water and TB was spreading in ways people did not understand and could not control. In many ways, those dangers are still present, in different ways, or in the case of TB, in many of the same ways. Our Mason County Public Health Department works tirelessly to protect the safety of its community by protecting drinking water, shellfish, air, waterways, waste management, sanitation, and of course, communicable diseases. For the sake of our tireless employees, as well as the public at large, we would like to work with the Board of Health to illustrate and highlight the value of Mason County Public Health so that our residents will feel the same pride and support that we feel. When you look at your tap water, when you look at the shellfish or timber harvest, when you take your breath of fresh air every day, we say to ourselves, this is public health. And because Darren Moody always likes me to end on a positive note, I would like to note that the life expectancy curve between 2000 and 2022 in Mason County has gone from being well below the state average to being right on it. And I am sure that we are projected to exceed it in the next 10 years. We currently have a life expectancy of 79.6 years of individuals that are born today in Mason County. Let's take that to the 80s and beyond. Thank you so much for your time for this presentation, and I look forward to your comments. Thank you.
Great, thank you, Dr. Gardner. Any comments or feedback from the board?
Well, one of my comments is, yes, children do need to be vaccinated, and unfortunately with COVID, a lot of parents, there was a negative thing about vaccinations. And so especially the HPV, that can prevent cancer. And my grandchildren are vaccinated, so I just think it's very important. And I also think that it's important to help with Hep C, because if you get liver cancer from having Hep C, it's basically death. And if we can prevent that, I think it's really important. But I'm also really glad she mentioned the fresh water, because that is part of our community. It's really important to me to be able to harvest shellfish, and I don't know. What does anybody else think?
Yeah, I agree with that. I would also say, coming from the school board perspective, we have very high rates of kids vaping in the junior high, and I don't think necessarily in the middle school, but the junior high and high school. So that is a big concern. It's a battle that they're facing all the time, and obviously that is nicotine or possibly marijuana, and smoking either one at that age is not
Does
appropriate.
not help brain development.
No. So that's something that when you bring up that smoking rates are high in our whole county, I'm also thinking they're also high in our schools. That is something that's a concern. I think that pretty much everything
that she said is important.
It is, yeah. And I do think that illustrating and highlighting the value of public health to our community is very important.
Commissioner Trask, Carrie, thank you both for your comments. And if anybody would like to contact me by email or set up a meeting, I would love to hear your thoughts on how we can achieve this.
Well, that was Peggy, but I would ditto what Peggy said.
Sorry, Peggy, I can't see you. I didn't recognize her. I thought that was Carrie. Thank you, Peggy.
Thanks, Carrie.
Can I say something on the fresh water? I think it's just as important keeping our fresh water fresh as the salt water fresh. And we don't have shellfish in the fresh water, but we do have fish.
Yes.
And I grew up on Lake Isabella, so it's very important to have fresh water.
When I go swimming in a lake, I want to know that I'm not going to get sick.
That's right. That's right. So that's very important.
Well, thank you, Dr. Gardner. I think plenty there for us to think about. And I guess, going back to the conversation, I think about Hep C and vaccination, I'm really want you and your team at Public Health to come to us with partnership opportunities so that we can work on these issues collaboratively. I thought you did a nice job highlighting the growing partnership between the city and the county on homelessness issues. We need to keep that front and center, but also on the substance use prevention and response side of things as well. I think especially as our opioid settlement funds come online and we start to think about how best to deploy those, whether it be in support of new programs or current and existing programs. It's critical, you know, and we want to make sure that we're giving our staff the resources that they need to go out there and help people who need it and are open to it on that front as well. And then, you know, you touched on the issues that we're experiencing with public health over the past couple of years, and really public health has been the tip of the spear, you know, on a number of fronts when it has come to the COVID response. And, you know, frankly, the vilification of public health has been, I think, a sad and significant setback, you know, statewide and nationally, and probably even internationally. And so whatever we can do to help support, you know, those day-to-day interactions that public health is having with the community, to help with, you know, continuing to build that, you know, that rapport with the community and the people they serve. I think we want to be partners in that with everyone. And so just, you know, when there are opportunities for us to lean into that work, please let us know, Dave and Dr. Gardner and your team.
Thank you.
Great. Anything else for us, Dr. Gardner?
That concludes my report. Thank you so much.
Thank you. Okay, we'll move on to our administration report. Dave.
Okay, so you have the director's desk. Just a quick look at influenza A, and this year influenza A came early, came fast, and has a kind of a typical influenza curve. It came in fast, not a lot of hang time. It's dropping fast. But we are not out of flu season, and usually we're not out of flu season until late March. So just keep watching. We'll see what happens. Board positions. I put this in here. We have on our board 2 positions that are open, for one for the Squaxin and one for the Skokomish tribes. I'm going to reach out to, these haven't been filled in ever, actually.
No.
And the American Indian Health Coalition has said that they would work with us to find a couple of board members. So I'll reach out to them and see what they have. They were going to reach out late last year. Let's see what's come out. So
I know they really wanted to make sure that we all know, that all the counties knew that they could reach out to them.
Right.
That we could reach out to them.
So, and Steve Kutz, with that group, actually used to be the director of public health here, way back in the day. So circle comes around. So that's great. We still have 2 unfilled positions, and I'm going to come back out. We'll advertise those again with the representatives of underserved communities. So it's non-medical representatives of people who public health serve in underrepresented communities. So we'll go back out and we'll put that back out again. We did it last July. We really didn't get any takers, so I think we'll need to reach out again and work that some more.
How are you reaching out?
So we reached out to a couple of groups, and I did put it online, and we did put it out through the county, through announcements, and got a couple applications, but they really didn't pan out. They were already medical people, and we really have medical already. One of the problems we have is we can't expand the other sectors until we have 2 people in this sector. So we need to get that out. So yeah, we're going to reach out in some different ways this time. And I think we have better partnerships than we did even a year ago. We know more people out there. We've been working with more people. And these other issues that Dr. Gardner's been talking about has brought us into contact with people that we haven't before. So I think now we have a way to reach into those communities that we didn't have before. So I think we're in a better place now than we were, even a year ago. So putting a rosy glow on on what was kind of a tough year this last year. 2022 was tough for public health. With that said, I'll keep working on bringing those back, and we'll come back to the board in our next board meeting, which will be in March. Strategic plan. So we last did a strategic plan in 2018, and that went through 2020. So you have the current draft plan, and this plan was done in conjunction with a lot of work by our staff. So last spring, we had an all-staff, and we spent pretty much most of the day working on the priorities for a strategic plan. And you'll see in here we have a pretty extensive SWOT assessment, which is strengths, weaknesses, opportunities, threats. And this is the unvarnished, pretty much unvarnished look at what our staff, had to say about our health department. So I incorporated that into the draft plan, working some of the things around homelessness, which has been a big push for us this last year, trying to take us out of just a strictly COVID response and getting us back into more of an upstream place where we can go and start knocking on things more in a prevention framed way. Vaccines, all these things that allow us to keep people from becoming ill in the first place, and kind of keep us out of the treatment end of things. It's certainly more cost effective. So you see the strategic plan in here, and we don't have the work plans. We're still working on our work plans, but I wanted to bring the draft strategic plan to the board, see if there's anything that you see is missing, something you want to see included, things that you think that are included that you'd like to see different.
More emphasis.
Okay, so it starts off looking like that, and it goes. It's like 13
I know
pages.
there's
Yeah,
it's
Upside down.
it's a pretty long document. Yeah.
yeah, and it has some good objectives and goals. I didn't really look to see how the goals would be measured, but I'm sure you have.
And that's where the work plans come in. So in the past, we've used work plans, and I prefer not to have a work plan that goes more than a year out, because things happen like COVID.
Right.
And it forces us to come back to the strategic plan and touch it every year. If you do the whole thing, it tends to get stuck on the shelf and doesn't get looked at again. Where if we do a work plan every year and do a review in December, how have we done? In January, have the new work plan for the new year. We tend to touch touch those things again, and it makes a big difference. So we have some things in here already, but you'll be getting the work plans at our next Board of Health meeting.
Okay.
So that's one of the reasons Dr. Gardner reached out with her presentation as is, because we'll be working on not just environmental health and community health and admin, but Dr. Gardner is going to be doing a work plan for her work as well. So we're taking this even more in depth than we have in the past. So any questions or comments on the strategic plan?
And then some of these positions that you have open that you have, like she had mentioned, what was it, a coordinator of something? Like,
Hep C coordinator.
C.
So
yes, so then
Yeah.
is that something that's part of like the budget that then fits the
Right.
strategic plan? And
so
it's
that we
all
have so the
guidance?
strategic plan really has to mesh with the budget that we're projecting.
Right.
So and we have money for Hep C. So we have $104,000 set aside per year for Hep C. So we have the money to do it. Now it's time to step out of COVID a little bit and start working on these other things.
Yeah.
Yeah, it's a state goal to have 0 Hep C, so I'm sure that
Right.
we're getting.
And we're the 5th worst county in the state.
Interesting. And I guess that's something that I didn't understand. Is that because of screening for that? Is that what it's highlighting? That they're just not catching that people
I
have
don't
it
think
until-
I don't think that really influences it. I think
Because
one of the
it's-
things we have is we're in this position between large metropolitan counties, and we're a bedroom community. Over 25% of our community, works outside the county every day. So we're like a micropolitan, that's what we're called. So I think we're influenced by the other counties that are around us that also have very high rates.
Okay. But are we just not getting treatment into people sooner or catching, or that's what I'm, with certain things with healthcare providers, are they, sometimes their focus is not on certain things. Is
And
that the
that
focus
certainly, I
or-
think, is a part of it. I think part of our healthcare community is not as focused on the treatment of latent Hep C because they are so busy with everything else that's going on, and the medical profession is stressed right now.
Yes.
For staff.
Just add one more thing on.
Yeah, and that's what I'm hearing is not one more thing, and we talk about that on the Choice Board of Directors. So you've got public health, and then the hospital CEOs are all on this board.
Yeah.
And that's the thing that's come up the last couple of meetings. It's just there's so many things going on, and the whole system is under such financial stress right now that it's difficult to reach out and to do new things. But we're going to see what we can do about doing coordination for people who are interested and physicians who are interested in tackling Hep C. So it doesn't have to be the whole system. We can reach out to a few physicians and start making inroads.
Okay. I didn't have anything else about the strategic plan.
Okay.
Okay, anything else? Anything else? Okay.
Okay, fiscal. We're going into a budget year with the state legislature. So this is a long session, and I kind of want to give my projections. Here, we're looking pretty good. I think we look very good. Compared to other budget years that we've seen. When I first got here in 2017 and everything went kind of south, we're looking really good in comparison. So here in Mason County, fine. With the state budget, I'm always concerned whenever the legislature is in session because budgets can come and go. So right now, we hinge a lot of what we do on the Foundation of Public Health Services funding, which we got into law in 2019, and they funded dramatically more money this last year. So, but they funded it in a way that we didn't get the contracts until late in the season, so we were able to use that fund like we would have wanted to, because you can't go backwards and build back. That's just not the way it works in local public health. DOH might be able to do it through OFM, but we can't do that year, so we didn't. But we are moving forward in ways that we haven't in the past to access those funds and use them. We have a health educator now that's funded through that. We have an epidemiologist that we're going to fill. We have our communication plan. We've purchased cameras and things because we're changing our focus away from a lot of documents that people don't read and spend more of our time doing video. People are much more willing to listen to a short video than they are a 14-page document on the finances of public health. So we're going to utilize those FPHS funds. We're due to meet again as the management team. We look at what's been spent, where we're spending it, and where our focus is going to be. So getting an epidemiologist up and running is a key thing. Another key thing is WIC, which I'm pleased to say. So WIC, as it comes to us, is we're being funded to do the prep work under a different contract than we will be funded to do WIC once we're up and running. So they're going to fund us to do the training and take care of that cost to get people up to speed, get the facility started, those without putting us under the federal contract. So we'll be doing a state contract, and then once all those ducks are in a row, then we'll open up the federal contract and we'll be a federal subcontractor for WIC. And that gets us out of an awkward place of having to do the audits for patient counts and all that kind of stuff until we're actually ready to do that kind of work. So that fiscal piece is looking good, especially since it's a partnership. And this is a place where I think we're starting to really gain some traction. It's a partnership between us and Mason Health and the YMCA. So we stand a better chance of being in the black much faster than other WIC agencies have in the past, where you're trying to pay for a facility. We're spreading some of the cost, spreading the responsibility, and I think this will make a much better system as we go forward. I think it'll be a model for other agencies as we go forward. So I'm very excited about that.
Do you see a timeline on that?
We're thinking June, July.
Okay.
There's a very rigorous training program which WIC will be paying us to do. So it's a very, I'm trying to think of the
lengthy.
Word. It's lengthy, yeah, it is. It very much
6
so is.
months to a year for a new employee.
But they're willing to help us out. For example, all of the IT pieces, we're going to be signing on to do the IT through DOH, and they'll provide the computers, the software, those sorts of things. And then if we want to migrate it into our own system later on, then we can do that as well. But they'll pick up the tab initially.
And these clients that are going to be served, are they now being served from the north and from Thurston? Or?
Yes.
Yeah.
So when WIC closed a little over a year ago, what, 500?
500. Most of them went to CMAR and Olympia.
Mm-hmm. So we're thinking most of those will be coming back to us, especially as WIC transitions back to in-person, rather than virtual
Yeah.
WIC clinics. So it's just awful tough to weigh a baby virtually, so.
Yes.
And I think that personal touch, especially with new families, is so very important to get them into the clinical setting, and it allows us not just to be fiscally responsible, but it allows us to direct people into other programs,
care.
right?
Yeah.
Other care, so we can coordinate with the hospital. If we use the same electronic health record, we can do interoperability. We can get them into see pediatricians. We can get them into children with special health care needs, developmental disabilities.
Dental.
We can start making all those contacts through this WIC portal. I think it's great, and that the state is helping us out is just very pleasing. I'm really pleased with how it's working out. So
Great.
fiscally, it just really makes sense for us to get into that and get the program up and get it in the black and take off from there. With that, we also have the opioid settlement funds have come in. So we got the first two, last year's and this year's, in one payment. And we are combining our funds with the city. So I'm working with Commissioner Schutte to get into, decide what we're going to do. And he alluded to it earlier. It's now deciding, do we want to continue to pay for things we're already doing, or are we going to branch out into new things? And really, it's kind of looking to what capability can we increase. And I've been talking to the Choice Cascade Pacific Action Alliance CEO about the state funds. The state's getting their own set of funding, and it's probably going to be going out to the accountable communities of health. So what does that look like for them? How are they going to spend the funds? Are they going to spend funds in our county? Are they going to do something regionally? What does that look like? And then how do we integrate the two things together? Or do we not integrate the two things together? We do our own thing in Mason County and then let CPAA do the regional thing. So haven't heard back. I've been out this week, so expect to hear back pretty shortly from CPAA and find out what the governor's plan is. Now, the governor's plan can change because all this stuff has to go through the legislature. So what the governor put out may not be what actually happens by the end of the legislative session. So we'll see. And I think that covers my report, unless there's any questions.
Great. Yeah, I think, just back on WIC for a second, just really, the benefit of being able to partner with Mason Health and the Y is super exciting, and I think it's a force multiplier for our limited resources and staff, and to be able to have partners like that. So I'm really optimistic about it, and you're talking about using that as an opportunity to get people dialed into other opportunities and services, even on the Y side, when you look at, childcare opportunities and things like that, that's exciting. So great job on that. Excited to see how that continues to roll out.
Thanks. Well, that's all I have.
Great. Anything for Dave?
Okay.
All right. Ian, environmental health report.
All right. To just tack on a little bit to what Dave said about our FPHS funding, we've also added one food inspector position under that funding and also one on-site code enforcement position. Unfortunately, both of those positions are vacant right now. They were filled for a short time and then staff left. We currently have 3 vacancies, food inspector, on-site code enforcement inspector, and then on-site permitting inspector. 2 of those positions we have filled, and those new staff members should be here February 1st. That's the on-site code enforcement and the on-site permitting position. We're still trying to fill the food inspector position. That's mostly what I have as far as the environmental health report. We do have a new policy that we've been working on with OSAC, is the On-Site Sewage Advisory Committee, and they're a group that has citizen members, a pumper representative, installers, septic designers, real estate agent representative. There's probably one more group member I'm forgetting, but there's several. It's a lot like this group. So we have a policy that's very old And I don't know who brought copies of the policy with them, but I can. That's the old one. Oh, you have it. And then I have the new version.
A little bit. Yeah, it's small print.
Yeah, I think the original old one was probably on like a 11 by 17 sheet of paper.
The other side
like,
is
yeah.
How old is it? How does it go back to? Like,
It was the farthest back I found any records for this was 1990 or something like that, somewhere around there. And then it had a few revisions. In 2001, it had some revisions, and if you look at the old version, you can kind of see there's some sections that are lined through. Those were the 2001 revisions. Unfortunately, this policy never went beyond that version. So we created on the back side what I'm calling the transcribed version, where we took that old policy, we transcribed it, and then we updated some of the regulation references. So it was, the old version was referring to versions of the septic code that didn't exist anymore. So we've updated that, but we realized that it needed to be officially updated and voted on by the Board of Health. And so we went to OSAC and we said, here's this policy, here's how we currently operate, what changes need to be made. So we updated some language. We updated a lot of language under the EH review materials and interpretation section, which is now a separate page on the new version. And the main change that happened with this policy that will affect, you know, the typical person that comes in to apply for a building permit and has an existing septic system is the low impact expansion section. As far as the septic system goes, they now would require treatment level B for the sewage going into their drain field. So one of the main problems that we have with, and this is the less than 100 feet to shoreline section. So the significant point with that is you're not really supposed to have a drain field less than 100 feet, you know, within less than 100 feet to shoreline. And we have a lot of systems, as you can imagine, all of Mount Hood Canal and the other shoreline properties that are, you know, some of them are only 10 feet to the bulkhead. They're really, really close, really tight conditions. People don't have a lot of property. There is a type of drain field called a dry well or a seepage pit. They're essentially deep ground injection of sewage. They're really bad, they're very harmful, they're very difficult to detect because, especially in an area like Hood Canal, there's a lot of subsurface flow through these really gravelly soils, and there's never going to be sewage surfacing at one of these systems and then flowing across the land and people going, oh, look at that sneaky stuff. It's just sewage traveling subsurface and then somewhere out below the tide line coming up in the marine waters. So one I guess balance we were able to strike with the industry and with contractors and homeowners in Mason County is to add a requirement for treatment level B so that the effluent is treated to a higher standard before it's entering something like a deep trench or a dry well, and that will help reduce some of the pollution. We tried to do away with dry wells and deep trenches completely, but it puts landowners in a really tough spot because they have this tiny lot, they have this system that's working. You know, I can't go out there and tell them your system's not working. I don't have any way to prove that to them or show them that. So I think it's a pretty good balance and a pretty good compromise to add treatment level B, and the designers all agreed that it was something that they were already pushing their clients to, is to add treatment level B. So that's the most significant change, is if someone has a low impact expansion situation and they're trying to use one of those existing drain fields, particularly dry wells and deep trenches. And sometimes they're just undersized drain fields. Their effluent is gonna be treated to a higher standard, and their, hopefully will be more benefit along those shorelines in preventing pollution issues. Comments, suggestions?
Question.
Sure.
Or comment. I had a realtor reach out regarding, I guess, so when a property is sold,
Mhm.
then they have to certify that that septic is running, it's up to par.
Yeah, it's an O&M inspection.
Right, and did the law change back in 2020 or 2022?
I have to look at the exact date. It was very recently. We did a presentation to the Realtors Association at the end of 2021. Is my memory is when we did that presentation to them.
Yeah, I want to say it was back in 2020.
Yeah, the most significant thing that changed is they used to be able to get just like a pumping and then say, okay, it's good, they got a pumping, it's good. And then we required an O&M inspection instead. The upside is an O&M inspection is a thorough inspection of the system, and it's typically less expensive compared to a pumping. Pumping is $500 to $700 now, and an inspection is $300 to $400 depending on the complexity of the system. So it's a better. It makes more sense from a public health perspective to have a thorough inspection and not just say get it pumped and ignore problems. So. It's been a positive change. The other minor detail with that one was we were requiring that it was just on the maintenance schedule, so gravity systems are 3 years, and anything that's beyond that with a pump was annually. So now it's any system within a year of the sale has to have an inspection.
Okay, good.
Okay.
Thank you.
Anything else?
If everyone's comfortable, I'd love to know if it's approved or not. But if we have comments or suggested changes, I'm happy to hear that feedback too.
Okay. Any recommendations for Ian?
We just send it to the board though, don't we? We don't approve it here.
Actually, you do approve it here.
We do?
And then it goes
Okay,
to the board.
so, okay. So I agree with Ian's changes. Look good to me. Positive. I don't want the seepage into the canal.
Or the fresh water.
Or the fresh, anywhere
That's right.
100 feet from.
Yeah, every shoreline house you see.
And there's a lot of
usually-
shoreline. You can't even hardly see the shoreline anymore. There's so many houses.
Yeah.
Yeah.
So I make a motion, we approve it.
I second it.
It's been moved and seconded to approve the updates to the septic regulations. Any discussion? Okay, hearing none, I'll call for the vote. All in favor say aye.
Aye.
All opposed? Motion carries. Great. Anything else for Ian before we? Ian, can you maybe just give a quick update on the Clean Water District?
Sure. For the Clean Water District, so for anyone who's not aware, we have Clean Water, Mason County countywide Clean Water District that was created in, the dates, I'm blanking on the dates now. I think it was the end of 2020.
One.
It was 2021 that we
I think we had our
approved
first
that.
meeting in 21.
The first meeting was in 2021. Didn't we vote to approve it in 2020?
In 2020,
Yeah,
I believe.
something like that.
Because it was
I could
before
certainly
COVID.
be wrong on the dates. So we started with the Clean Water District back in 2022 is when we really had our funding in place and started spending it. The Clean Water District applies to all the portions of Mason County that drain into either Hood Canal or South Sound. So the biggest portion that's excluded is the portion that drains to the Chehalis, like out far down Cloqualum, Elma portion of the county. That's not covered in the Shellfish Protection District. And it's supported by a parcel fee of $5.06 that is applied to all the parcels within the district. And that funds work to do surveillance and investigations for pollution sources. Most of it is focused on marine shoreline. We can do some work on freshwater lakes, but it's fairly limited when it comes to that, because the state regulation it's based on is focused on shellfish protection, and thus pollution sources that are really far upland typically don't make it to marine shoreline. So the bulk of the focus is on those marine shoreline areas. But we can do some lake work with it if it's warranted. Right now we have two really big areas that we're focused on. Annis Bay and Oakland Bay are the two big downgrade areas that we're working on improvements to, looking for pollution sources. And that involves our staff walking shorelines, collecting freshwater samples flowing off of the shoreline into the marine water. Also monitoring major rivers and creeks that are flowing into the marine shoreline, and then following up, investigating high bacterial results that we find. We have a Clean Water District Advisory Committee that has been very active, and we struggle to fit everything into our meetings, so we have a lot of citizen, one tribe, the Squaxin tribe, and then all of our state and local partners that are working together to build our program and implement the program. We have just recently created a web map that went live today, so people can go onto our website and look at our ambient monitoring results. So the ambient monitoring results are those results of where we monthly sample the major creeks and streams. And you can go on there, you can click on a data point, and then you can see a bar graph of our results. Right now, I think we have 6 results on there. The goal will be to have a geomean calculator for each of those, so you can see if we're meeting the state standard or not. But we're one of the few counties that has that. There are a lot of other more well-funded counties that don't have that, so I'm really happy about that. And we have all of our raw data also posted on our website. One other minor area we have is Jones Cove, is a recent downgrade area that was closed. Jones Cove is on the Pickering Passage side, near, not too far from Geist Point, and that has been downgraded. It's been closed for pollution sources upstream. That's a separate kind of mini project area, and we have a grant proposal with the South Sound project to try to get some specific funding to work that. But if we can't get anything, we will use Clean Water District funding to do some work there. We're trying not to stretch ourselves too thin, because Oakland Bay is a major issue that we don't want to get worse, and Annis Bay is also a major issue that we don't want to get worse.
Great. And if anybody's interested, we have our quarterly meeting in March coming up. So stay tuned for that.
Yeah, I can send anybody the Zoom
You should
link.
just send it out to all the board of health.
Yeah, that's a good idea.
Okay, yeah.
Great. Thanks, Ian. Community health, Melissa.
Hello. I feel like everyone's already covered a lot of my updates. I'm going to highlight a couple things. Super duper excited right now to be doing the strategic planning process. I think as we work on our work plans, one of my biggest priorities, Peggy, you mentioned something earlier about how do we measure things. That's a really big priority for my work plan for community health, is to really kind of take a step back. And we're coming into a period right now where a lot of grant cycles are ending. We're looking at, strategic planning going forward with what are we going to do, a request for proposals for different programs. So I really want to take a step back and look at, have we actually moved the needle on what we wanted to move the needle on? What impact are we actually making? And if we aren't doing that, then how can we improve and kind of modify some things as we go into this next grant cycle? So those are some of the things that are kind of coming up for us. Really excited about it. Super excited about the direction that our communication is going. Dave mentioned earlier we have Emily, who I don't recall if we were able to introduce her on the last Board of Health, but she's here. Emily Lehman, she's our new health educator, and she's just really hit the ground running. She created the beautiful Board of Health report, so it's not a 9-page report anymore. It's a little bit more attractive. We're doing a lot more with video work, and as of last week, we're actually really kind of taking some strides to get our Mason County Health Coalition back up and running, possibly doing a big kickoff event, so stay tuned for that. And I don't want to take up any more time. I actually really want to kind of hand it over to Ben Johnson. He's our Substance Abuse Prevention Coalition coordinator, and a lot of, as we've looked at data over the last couple years, we've updated our community health assessment. There's been a lot of gaps just because of COVID. A lot of data is not available, and so I've always said though that quantitative data only tells half the story. So even though we haven't really had a lot of quantitative data to work off of, the qualitative piece tells the full story, and that really comes from having community voices and youth to talk about our substance abuse prevention work. So I'm going to go ahead and just pass it off to Ben to just kind of describe a little bit. I think on a previous Board of Health meeting, we talked a little bit about the direction of our communication in regards to the substance abuse prevention work with youth is really kind of focusing on the positive social norms, not so much on what are the negative things that are happening. I think, again, with the lack of the quantitative data, a lot of times the qualitative piece comes from things like social media, and an event might happen at the high school and you have all these different narratives that are being shared on Facebook, and we don't actually know if it's true or not. So that's where Ben has come in. We've done a lot of work together over the last 2 years, doing listening sessions and focus groups with youth to actually find out, what are you noticing? What are you seeing in your peers, and what has your experience been with substance use, or vaping? Has, like you said, Carrie, there's a really high rate of that in schools. So I'll have Ben kind of introduce a little bit some of the Choice High School Youth Leadership Group representatives that we have to share.
Sure. Well, thank you. And thank you for being very patient and giving a little education today. I know that we're pushing up on time for you, but thank you very much. Yes, a lot of things you're talking about here in with environmental health, what Ian was talking about, is part of its prevention. You guys even mentioned working upstream and stopping the issue upstream and keeping it from polluting our water downstream. That is environmental prevention. That's exactly what we're doing with the students right now. We have 3 groups that we're working with: Choice, Cedar, and North Mason. And we're trying to get into Shelton High School. It's been a little while since we've been at Shelton High School, since the SAD Club was there. So they now have a prevention person that's working at the high school level. So we've made, Joni Cagwin is her name, been making connections. But I want to actually turn it over to the students. We've been working on 3 projects: the CAN survey, which is the Community Alcohol Neighborhood Survey, Community Norms Project, Community Mapping Project, and an alcohol and cannabis listening sessions. So I will turn it over to the students, and you can introduce yourselves again, what grade you're in, and talk about how we already kind of coached them a little bit last week, talked about how this would happen. So who would like to go first? And
anyone can go first. It's okay. I will take it.
Okay.
I'm Nina Spia, Choice's representative, and we've had Ben as a guest a few times with our leadership class, and what I think is really unique about this specific leadership class is that we range from our middle school, which can be down to 7th graders, to all the way up to seniors. So this is a pretty wide range of students with different experiences. So what we hear is pretty combined in between age groups. So I think what is crucial now is that we're starting to target our younger youth as well, so that we're educating them on these consequences, and they're able to kind of have more education into this industry that can sometimes be romanticized by, at times, social media or even the advertisements that we do, which leads me up to our CAN survey. we took a group of our students over and walked around our local places, some being like gas stations and other places where we know we can find these substances that are being sold. And we kind of took a look just outside and saw the advertisements. I know that we talked about Bayshore, which was a really big one just because of how attractive the building is. I talked about my personal experience and how I actually found out it was a cannabis shop. I was asking my brother, I go, hey, like this is a really cool building. It's got like paintings on the outside. There's a really cool car in front. And to the point where I didn't really look at what they were really trying to promote. So I think that kind of having that vision and sharing that among the students helps them recognize how this industry works to attract youth and younger adults, because we're now learning to understand that this industry really targets us because they know that with time they'll have a loyal base, right? So I thought that was really awesome to in real time get to experience that. Another bit of information that we've got was conversations. We've had some questions led by Ben that really open up these uncomfortable situations a lot of the time, because substance abuse is unfortunately very common among not just youth, but family members with the youth. So this can sometimes be a really sensitive topic to some students. But we find that students are really passionate about talking about this stuff, because a lot of the times it's not a conversation you have at home, right? So we've got to really hear all of these experiences from our students and combine this knowledge. So what's funny to me is that we realize that a lot of our students actually pointed at some of the more common places where we know we're struggling with. So for example, we know up at the high school sometimes we have issues with our huff and puff. And a lot of students speak about how they've been with friends and they've experienced, either they've watched some kind of illegal activity or they've heard about it. So we kind of just talk about very big target spots and how our youth is really getting to this stuff. Because I mean, there's obviously laws that prevent students or youth to buy these things from actual shops and different gas stations, but we know that they're getting a hold of it somehow, right? So it's really important to really listen out and hear like the different ways that our youth has been being able to get a hold of it, so we can take a step forward the right direction, So yeah, and I'm gonna pass it over to Jack.
I've been seeing a lot of promotion for like drugs and stuff, and I noticed that not only has it been promoted like what Diego said through buildings and stuff that attracts little kids' attention, and not just little kids, older people too. And I noticed that a lot of times not only does social media attract it, so does stuff like music albums, and they have cigarettes and like, oh look at me, I'm cool because I'm smoking. And I've had personal experiences where someone like offers me a cigarette, and like I feel like if I have had more people were able to notice that this is going on, that maybe they would realize, oh, this isn't good. And I feel like a lot of people still do it even though they know it's bad for them, because friends peer pressure them, and it's just like if you even see it on music albums, just yeah. I don't really know what else to say about it because Neo said most of what I was going to say.
So, like Jack and Nieves have said, we have the social media that a lot of kids nowadays have because their parents are allowing them to have like iPads and phones and stuff. Those kids are saying that these people are having cigarettes and stuff in their photos, so they're saying, oh, this is cool, I should try this out. And what is also happening, like Nieves and Jack have also said, is stores are attracting youth by putting cool decorations like flashing lights and like brighter lights to attract kids, and some stores aren't even like asking for ID when it comes to youth buying stuff. So my friend, he's like my age. He somehow has like vape and he's smoking. I don't know how his friend gave it to him. And it's kind of concerning me that he is like allowing himself to do this, because I did it and I got in trouble for it myself by my parents, so I'm trying to stop doing that. And I think it is bad that the youth is now getting like added into all of this smoking, vaping, drinking and stuff.
So, do you recall some of the social norms project that we did? And
yeah, I also wanted to add something.
Sure.
It's kind of about social norms. I also noticed that a lot of people kind of classify it as just a normal, cool thing to do, and that I noticed that a lot of times, not only are they getting it from friends in stores, but a lot of times I think parents are also suppliers, because parents can legally do it, because a lot of times they're over 18. So basically they could get that and give it to their kids because, you know, it's okay to do, they think. So I think that it's not just kids who are getting like all these things. I'm not trying to say that. I don't know how to phrase it. But
Supplying.
Yeah.
so that was part of our listening session. We went through probably 20 questions, and you answered as a group about how you thought people, your friends, we weren't IDing anybody, right? We weren't saying that person, that person. Right. But where other students were getting it, how they were getting it, friends, were they sneaking it, were they stealing it, were they buying it, were there certain shops around? We did a mapping project that said these are all the kind of hot spots and these are the positive spots in our community. We did a social norms project where we had some data from the Healthy Youth Survey, and the students came up with, they were actually so specific on the posters that we ended up making. Most kids don't do this. Okay? The ones that do it end up getting in trouble. They vape, you know, the principals are, but I was at a workshop, by the way, and there was like 15 principals. They all had the same issues with vaping. They could not control it. It was in the bathroom. They can't put a teacher or an adult at the bathroom all day, that sort of thing. And it's a major issue at almost every, you know, middle school through high school.
I want to speak a little bit about the social norms project. Well, specifically for this project, we split up our class into multiple groups, and we had everybody tackle an issue. So everyone had a little bit of a different issue that they wanted to make a poster about and promote. So we all kind of educated ourselves into this certain topic, and that way we were able to share with our class what we knew. And by doing this, I believe that we are promoting better decisions for not just themselves, but other students. We went around our school and put up some posters, and hopefully we also made some presentations. Hopefully we'll get those soon running into advisories. So every homeroom has a presentation that they can show up in their classroom, and maybe that's a conversation starter for that class, you know? So we want to expand a little bit more than just leadership, and then really we're such a tight community at Choice that we're able to do so many more things with these conversations. So we're definitely focusing on getting them more through our other classes, and having these conversations that can sometimes be uncomfortable but really, really important, because we do know that we are now, through the statistics, starting really young. So unfortunately a lot of it is in school, and I believe that is just because we have so much exposure to different people and just a lot of easy access. So.
I would say, I think that maybe kids should start being taught from a young age, because I remember I was like pretty young, and like more younger than you would ever think that I would be exposed to this. I saw someone smoking on the street, and I had this friend and was like, hey, that person's really cool because they're smoking. And so I thought, hey, this is cool. And I would take french fries and pretend to smoke until my sister told me that was really bad. And that's when I learned, oh, and then I stopped doing that. But I also, you know how sometimes you can take drugs through pills too. I used to pretend that french fries were pills too because I thought this was cool. I didn't know. So I think younger kids are, it's just getting younger and younger, and that they need to be taught.
Anything else you want to share?
I do not have
Okay.
much to say of these two.
So we do have the three different programs. The county actually provides a little bit of funding for their youth groups, and we have a small contract, and we ask them to do actually these types of projects for us to share with their schools. At Cedar, it's an LGBTQ group, and at North Mason, it's a similar type leadership group. So, and at North Mason in June, they do a safety days. It's a 4-day presentation at the end of theirs. The high school students present to the elementary school students some, you know, if you find a syringe or anything that's unsafe, medication, what do you do with it type thing. And that's kind of an exciting, fun 4 days at the end of their school year. So yeah, we do. So they don't have to go out and do a lot of bake sales as much, you know, that sort of thing, car washes. We give them a little bit of funding to provide prevention services at the school level. That's kind of, we just wanted to share that with you, and that's happening, and that we hear a lot from our communities and nothing's happening with the students. Well, we want to let you know that things are happening. And most of the students, most of our students are doing the right thing. Most of them are doing the right thing.
So I would say I love those posters. That I love that you all created those posters, because that does show the positive side to that. Somebody doesn't have to feel like I'm the only one that's not doing this when I say no.
Right.
Actually, there's more of you that aren't.
Can I really quickly say something about the syringes actually? So, I believe it was either sometime this year or sometime last year. Well, there was one time this year, one time last year. I'm trying to remember. I think it was 2 this year. I'm not sure. We went to the field and we see this guy sleeping on one of the tables, and there's like a bunch of syringes scattered on the ground. And me and my friend Sebastian were walking back home. We see this guy on a bench and a bunch of syringes just lying around.
Yeah.
And it is pretty easy for like teenagers and stuff to like take those.
I've seen similar things to that. I've seen people just
Or
totally
accidental
crazy.
sticks, that sort of thing, right? Yeah.
Along with the posters, I think that what is really awesome about this is that we are not just hearing older people talk about this, but we are hearing our own age group. So I think that in that way it's a little bit more influential because we relate, you know? And I think that especially with this generation, a lot of the time on social media we see this romanticization about substance, and you know, you hear about, oh, you can be skinnier, and you know, we tap into these other uncomfortable conversations that are like eating disorders. So a lot of this wraps up into one connection, and I believe that if we come together to start promoting more prevention and more help, because even at our school, you know, there's a program called Turning Point, which targets people who are struggling with substance abuse youth, a lot of it. So it's just, you know, promoting that more and saying, hey, you're not alone, you know, and when you do need help, there is help for you. So I just think
That's another key that we got from the listening sessions, that students know where to go.
Right.
They know, you know, where to go for help. Specifically your class, that when we did that listening session, that's one of the questions. Just about every one of those students said, yeah, we have the ESD 113 student assistance professional that they can go to. So again, it's just, I think there's some misinformation out there, and we just want to make sure.
Also, you sometimes could just see even teenagers sometimes just out on the sidewalk and like the street and stuff, just walking all crazy, and obviously that they're on drugs, and it's scary because they do things and that can harm other people and themselves, and honestly, it's just kind of scary when people are getting alcohol and stuff as teenagers. They do dumb things. I mean, anyone does, but especially when you're a teenager, just having drugs on it just makes it even worse. They already do stupid stuff a lot.
Anybody have any questions?
I had a few things.
Okay.
First, thank you so much. You are so brave and you're such great speakers. I wouldn't be able to do this at your age. So thank you for coming and speaking here. One of the other things I wanted to know is that the dollars that we get to do this substance use prevention work in youth has really been focused on like tobacco, vaping, alcohol, marijuana. As there's more fentanyl use and that threat is emerging in our community, that is something that, especially that we have Emily on board as our health educator, it's something that we really want to start taking a look at, increasing our education that way. So we're kind of starting that up a little bit, doing a little bit of research. But it's just really important to have these youth voices, and thank you again for sharing, because it really helps us target a lot of intervention and understand what's a really effective way to engage young people so that we can really work on increasing the positive childhood experiences that you have and really help reduce the adverse childhood experiences. So yeah, we really appreciate it.
Thank you for having us.
Thank you.
Yeah, thank you all. It's really good to hear from you. I think there's a lot of us around the table. We have some fancy titles and we have different and interesting jobs, but the reality is that if we're going to see change in our communities, it's going to start with you and your generation, and you're going to be able to really move things in a good direction. And so we're here to help you as much as we can, but we're also here to learn from you and follow your own leadership. So thank you so much for being with us today.
My parents over there have always taught me that it's not good to do things from a really young age, and I understand that not everyone can do this, but it would kind of be nice if everyone was able to have the same access to information that I did and was able to understand it, and just was never going to start it. It doesn't start it, but unfortunately that's not always the case.
Well, thank you for being proactive and having a voice in it.
Yeah, I have a little bit of an opposite experience. I come from a Hispanic background, so a lot of the time these can be really, really sensitive topics, and it's not something that you hear at home often. So I think that even me, I've been trying to expand this into a more bilingual thing, so that even the other students that they can share this stuff at home with families, because I think that a lot of our Hispanic community doesn't really understand the full extent to it. A lot of the times the news come in a different language, and it can be scary to hear all these things. So for parents to know that we really are truly working to make a step forward, I think that is a huge, huge improvement.
She offered to present today in Spanish.
I wouldn't understand.
Thanks, Mom and Dad, for coming along today, too. It's great to have you here. Yeah.
And I think I know you're already very late, so.
I head out with that, sort of.
Okay.
I mean, my dad wanted me home, but he said he could also.
Okay.
Go, so.
Oh, you
But it didn't really have time. So.
Great. Thanks, guys. Appreciate
Great job.
it. Yeah, very good.
Thank you, appreciate it. Now, see you guys probably a couple.
Thanks for having us.
Yeah.
Anything else, Melissa?
I think that's all.
Okay. All right. Our next item up is other business and board discussion.
Well, just kind of a segue to build on what they were talking about was we're sending three of us are going to a conference called Agents of Change. I went in 2020, early 2020, probably the most valuable conference I've ever been to really learn about how do you communicate in very targeted ways. Looking at demographics, micrographics, the groups within groups within groups, and how you target those messages, and how do you make them different and make them appealing. So I'm going, Melissa's going, and Emily is going. So learn how to really focus what we're saying to the right groups, and they're having the right message.
And when is this?
That's in March.
Early March.
And the different subcultures. Such
Yes.
as?
Well, and, you know, it's like, you know, you have, within the high school, you don't have, it's just not just high school kids, you have kids that are the sports kids and you know, different groups, you know, and even subgroups within those. The messages have to be tailored, you know, to each of those. And that's what we're going to be working on, part of our communication strategy.
On the summit?
Oh, yeah, why don't you pitch it?
Yeah, so we're planning on a substance abuse prevention summit. It's going to be an all-day event at the Skokomish Community Center, and it's going to be open to all of our community. Probably 150 registrants with a meal that day. Guest speakers, probably about 5 during the day. It looks like we might be moving it to April 14th because our key speaker couldn't be there because of spring break and all that kind of stuff. So we wanted Dr. Jason Kilmer to be our keynote for that day. So it looks like April 14th. I just got an email. We're working with FES, Choice Regional, ourselves. There's a lot of partners, the Skokomish Tribe, you know, all that. So you will get invites. I mean, it'll be out there. So it'll be free.
Great.
Oh, and I think Diedrich, you just learned this, Diedrich, so. Diedrich we're working with Diedrich too, but I don't know if he's available now. Yeah.
No pressure.
Yeah.
Okay. Any other business or board discussion?
I would say from my school board perspective, we're really happy that the Y and Mason General are partnering with a clinic that will be at the Y. It's my understanding they don't have a provider available just yet, but pretty soon that will be up and going for people to be making appointments, so that there's a provider available for students to come over
it's
with the
been
permission
really
of their parent.
positive in the North Mason
That's
School
what I
District,
understand.
so.
So it's just gonna open
Yeah.
up some access and opportunities there for families and students. That's going.
Great. It's really good. You know, I think for our next meeting, if we could have a little bit of time set aside to talk about our substance use programs a little bit more in depth, given just kind of where we're at with the settlement money and some of our other grants winding down with R4 and some of those items. And then also I think having a bigger discussion about Narcan and our ability to push that out into the community. I mean, the true antidote to a lot of the overdose issues that we're seeing. And I think I would also just like to challenge public health back to, you know, how do we target our Narcan distribution to places where it's going to be the most effective? I mean, bars, restaurants, you know, where there's other, you know, alcohol served and those kinds of things, higher risk areas. You know, and we had a conversation at the Y last week about utilizing Narcan up there and bringing that in just as, you know, another opportunity to get that out into the community and get some people trained up and have some of those, you know, those opportunities as well. And so just kind of like looking for more partners to work with on distribution and that kind of thing. I know Commissioner Netherland was working on getting into some additional places up in North Mason, and so, you know, I think we can look for some of the same opportunities countywide. You know, and maybe using Ian's food inspectors to get, you know, some of that distributed to other places as well. And we just really need to have a surge of that into the community as another element of our opioid response.
I actually had a situation. I was at the pharmacy and I happened to have a Narcan that somebody's dad or mom died and they had one, so they brought it in so that I could give it out to somebody else. So it was free. And I had a kid run from the bus station, the little bus stop, and said, I need a Narcan now. Gave it to him. As far as I know, they survived. But I mean, it was like an emergency thing, and I was thinking, we really need to have those as an emergency there in the store just to give out. But I mean, I don't want to give out $100 Narcan to somebody I mean, basically, I'm just free unless, but if somebody really needs it, I don't want them dying either.
Well, I think there might be an opportunity for us to look at our fund balance and treatment sales tax, and consider purchasing additional kits. And, you know, one of the things that came up at the opioid stakeholder group meeting earlier this month was North Mason is looking to place Narcan kits in their schools.
We have passed
yeah.
policies for all schools in the Shelton School District to have Narcan. At first it was the high school and OBGH, but it is all schools. But there has to be training too, and I understand the health department is going to be helping with that.
And so their question was, you know, how do we get it? You know, and so then the conversation is, well, how much do you need? And then, you know, how do we target it? And how do we use some of our financial resources to help the school districts, help other, you know, business owners where there might be, you know, a higher likelihood of overdose. So just something to put back on your team to maybe think about over the next, you know, few weeks as you know, are kind of fine tuning some of the, you know, stuff for the next meeting.
And where they're placed and how they're stored. I know that Dana was talking about having some out by the football fields and strategically, but storing them, you know, how do you store them so that they're not
the weather
just
and
taken or
or
you
just
know,
Some places, you know, we're talking about placing them with their AEDs.
Well, that's what I was thinking. If any place that had an AED should have one of those anyway, but.
Yeah.
Does the Mason Transit have?
So we had that conversation at the last board meeting, and so Amy Asher, the GM at Mason Transit, was, in fact, I have to follow up with her, but the next day was having a conversation with our insurance provider at MTA to see if there were any issues there. I mean, I think my interpretation of things is I think there are broad protections under the Good Samaritan laws when it comes to that, but I think transit is another one of those places where it makes a lot of sense to have you know that available and get their staff familiar with it and trained on it and really have that as another you know partner in this effort too. So yeah, so I have to follow up with Amy to see how that conversation went, but I suspect that that it'll be allowable. So, okay. Anything else?
Shoot, shout out to them.
Yeah.
Thank you for going out there and for everybody for going out and working. Thank you for coming and presenting. I don't like to public speak, and so you didn't know you have to.
Emily, did you want to take maybe a minute or so to introduce yourself? And I think some of us have met you and obviously work with you every day, but just for the.
Sure. I'm Emily Lehman. I'm the new health educator for Mason County. I've been here for just about 2 months. I'm originally from upstate New York, so still getting acquainted to the area, but yeah, I'm very happy to be here.
And she's doing an amazing job. She's been shadowing me quite a bit and helping out with the listening sessions, and yeah, and she has some great ideas. So that's the bottom line. It's really good.
Yeah, we need those young ideas.
Yes, and technical help.
What is a TikTok?
Yeah, exactly.
Yeah.
Excellent.
Just
Well,
hand her my phone.
Yeah.
Can you fix this? Yeah. Well, Melissa does.
I'm almost at the age that I don't know.
We're just cheaters.
Well, I can watch TikTok. I don't know how to make them.
Well, we're happy to have you.
in there so that the access is just
Next up, we have public comments. Any comments from the public?
parents' permission.
Constance.
And be seen.
Yeah, my name is Constance, thank you guys.
Rash on the skin.
My name is Constance Gibson, and I live in Union. I am
It's really nothing.
a co-chair of the Lower Hood Canal Watershed Coalition. I've been involved with that group since about 1999. And I'm also very involved in the Clean Water District. Though I'm not a member on there, there are people in the Watershed Coalition that are. I'm also a member of the On-Site Advisory Committee as just, you know, I'm not a professional, I'm not a designer. But I do have a lot of people who come to me about questions about their septics, and I still don't understand mine. Even though all the training I've been to, I'm still like, how does it work? But I'm here today because people come to me and ask me things because I don't work for government, I'm not regulatory, and they think I should know something. So we've had the king tides and continually some high tides. So people are like, what should I be doing with my septic system? And that's a really tricky thing, especially, we're talking mostly of those along the shoreline. There's also, because we've had so much rain and we do have some wells along the shoreline or kind of springs where people get their water. People talk about, you know, oh, my well has all this grit in it. What's happening? What should I do? So I'm here to really encourage the environmental health to be able to, maybe with these, maybe you could make some local videos so we could target people and we could see them, maybe come to a local meeting now that we're not, we can meet person to person, it might be really helpful, or even have them on the website. But people like to ask questions. And then the other thing that I would really like to get clear for all the different meetings I go to is in health is like, I want to know if there's any match between, we have these different funding sources, state and then indirectly federal money's coming into that. But how much discretionary money, how much money there could be from the county? Because I don't know if it's a match between what we finally may determine, or from year to year it changes, what our community priorities and what the funding source is. And for me, a lot of the time, the county has, because we don't have that much money, has been driven by grants. I mean, sometimes grants have been applied for that don't even really make sense, but they pay people's wages and maybe they can do something else. So I would like to have that a little clearer so that could be, this is a priority, this is required by the state, this is required by the federal government, you know, what is that? And I think for people to really understand and integrate that environmental health is integral to community health, is we need to have more people talking about it. Nobody wants to talk out loud about their septic system. But we have to break through that and talk about that and educate ourselves about that. And I would really like to see more work done on that. And I'm really glad to see the Clean Water District is here. And I know that I saw the website with the data. Oh, yeah. I did. Yeah, so I'm very excited because I looked at all the ones near me. And so that kind of data, when people can get that data that is, they can relate to, oh, that's the creek near me, or that's the river, they start paying attention. So those are just things that I would like to kind of integrate more this environmental health. And people make up things. You know, they go, oh, my water's great, I have a private well. Oh, well, that makes So we need to let them know maybe they should be checking that. I mean, really, people say that to me all the time. So that's all I have to say. So I look forward to working with Ian even more. I'm sure he appreciates all my information. Okay, thank you.
Thanks, Constance. Thanks. Any public comment on Zoom? Okay, we'll close out our public comment and I would entertain a motion to adjourn.
I so move.
I second that.
Moved and seconded that we adjourn. All those in favor say aye.
Aye.
All opposed? And we are adjourned.
Question for you.
Until next time.
Yeah. So